Welcome to Reactions Inflammation Wars, a place where you can come and study inflammation battlefields and learn how to become victorious with your own inflammation and pain management battles. The featured battlefield in this study will be the pathogenesis of uncontrolled inflammation and its relationships with pain, tendinitis, injury, surgery, and osteoarthritis. Let's meet the fighters that are leading the charge in this battlefield. Our fighters come from a small distant place known as bone marrow, where they grow up as little stem cells. When they grow old enough to become monocytes, they begin their adventure away from home and into the bloodstream, awaiting to be called up for duty, the day they are signaled by the cytokine recruiters. At that moment, they will transform into their true purpose, the duty in which the macrophage has to fulfill. On the left, we have our first transformation, the M1 macrophage, better known as the destroyer. He has first boots on the ground. He debrides and cleans out damaged tissue, driving inflammation and pain. He is smart, although confused at times, and nothing gets in his way. There is a reason he is known as the destroyer. On the right, we have our second transformation, the M2 macrophage, widely known as the healer. He is such an amazing dude. He is second to arrive to repair the battlefield. He comes in and takes away our inflammation and pain. He heals and regenerates our tissue. Together, they are one balanced, dynamic duo. Typically, destroyers are activated first to begin attacking and cleaning up foreign, infected, or damaged tissue. Healers are released later on to begin healing and regenerating the tissue. We all love what we do, but have you thought about how your daily activity and overuse of your body is affecting you? Chronic inflammation doesn't happen overnight, and destroyers tend to get irrational, confused, impatient, and aggressive over time. The inflammation process progresses from overused tissue and joints, and when this occurs, the destroyers officially get fed up. We all have ambitions and tend to push the limits to reach our goals. No pain, no gain, right? Destroyers thrive when you are in pain and are now sending reinforcements. Destroyers are even learning that the overused tissue is a problem they want to eliminate. The first signs of pain, not due to acute injury, is typically due to prolonged inflammation known as tendinitis. This pain is uncomfortable and tends to occur because the destroyers are increasing in concentration and are not leaving. This pathology is the beginning stages of osteoarthritis and tendinosis, as well as increasing your risk for serious injury to occur. Once the first signs of tendinitis or joint pain forms, people typically will take an over-the-counter anti-inflammatory drug known as NSAIDs. This medication does a great job at reducing the amount of activated destroyers causing pain, stiffness, and swelling. Unfortunately, NSAIDs take over an hour to work, resulting in prolonged tissue exposure to destroyers, inflammation, and overactive pain receptors, known as nociceptors, which is continuing to increase destroyer hypersensitivity to cytokine signaling. The continuation of overused joints and tissues, such as tendinitis, without adequate rest and preventative health care, pushes the destroyers over the edge. Hypersensitivity in action. The body has officially made reinforcements, known as antibodies, for the tissue that keeps sending the same cytokine signals due to overuse. The destroyers are not only sending the cavalry, they are sticking around. Just imagine the damage they are doing to your body. The intensity of the inflammatory response becomes unbearable. Any activity that involves an aggravated joint that sends out any cytokine or pain signals a flood of destroyers. This process causes overproduction of synovial fluid, swelling, pain, and even diseased tissue, resulting in crepitus, instability, fibrosis, weakness, chronic pain, stiffness, dysfunction, injury, surgery, and eventually osteoarthritis. Osteoarthritis is a degenerative disorder that has no age restrictions and is a serious progressive chronic condition that occurs over a period of time. It affects over 35 million Americans due to uncontrolled inflammation, obesity, overuse, injury, and poor treatment of their joints. They live with chronic inflammation, stiffness, pain, and surgery that continues to progress with their age. Icing the first 20 minutes is crucial for overused vulnerable joints immediately after activity and injury, regardless if pain is present. The inflammatory process has definitely been activated. Icing reduces the initial immune response, slowing the progression of destroyer hypersensitivity from becoming overly aggressive to cytokine signaling. This will in turn promote a balanced concentration of the dynamic duo to do what they do best, debride and heal. Icing is not a premium, it is a must for all that want to continue doing what they love to do. Thank you for watching this episode of Inflammation Wars, featuring the ongoing battle of uncontrolled inflammation. This is brought to you by Reaction. Don't wait till pain strikes, react the moment inflammation occurs. To learn more about how to manage your inflammation and pain, visit reactioncare.com. Here is the treatment tip for this episode. Stay active when icing joints. You should keep the overused joint active when icing. Under normal conditions, this will promote healthy blood flow, regulate the destroyers, and optimize the healers to produce the best outcomes when controlling your inflammation and pain that promotes tissue regeneration. Our disclaimer: do not continue activity of a joint that has just been injured. These are abnormal conditions. Ice, secure, and elevate the joint and consult with a physician immediately. And remember to check in frequently for new Inflammation War episodes and to keep up the good fight. You're worth it.